The Alamosa Salmonella outbreak of 2008. Alamosa, Colorado is the county seat of Alamosa County, but maybe more importantly, it is the cultural and economic hub of the whole San Luis Valley. And so therefore 6 counties really look to this as the center of their daily lives, or at least their economic lives. The town is about 75,000 feet above sea level, and about 9,000 people live in Alamosa. Again, with many more, about 50,000 people in the area that definitely rely on Alamosa for a lot of their day-to-day activities. The area has been plagued by poverty for generations, but there is also a lot of history and a lot of culture in the area, including the oldest town in Colorado. In the spring of 2008, people in Alamosa began to report diarrhea infections. It took about 2 weeks until the response was adequate enough to eliminate the contamination. Most likely, this resulted from cracking in the system, in the pipes, in the storage container, and due to animals being in the area. There's no direct proof of animals, but there were footprints, and obviously the violation of my second most important, or second favorite, public health principle, which is don't drink where you poop. Salmonella most likely got into the system through animals in the area who were defecating in and around the water storage container, contamination of the system, and therefore leading to really what became a very significant outbreak in the town. Because the town was so old, in fact, some of the plumbing may go back to the time before Mexico even seceded that section of the state to the United States 150 years ago. The pipes were not able to stand up to immediate chlorination, and there was concerns that even as they did chlorinate later, that they would crack, and so the town had not been chlorinating their water. There was a significant effort at the time being put into improving the system, including a $10,000 facility for water treatment that had not yet been online, and that was coming along, but at this time it hadn't been in place. So that was a complicating factor. Another complicating factor is the water, where the water source was already contaminated with low levels of arsenic, and boiling water would concentrate the arsenic. So when the outbreak first started, people were told to begin drinking bottled water, which in a small town of that size, very low income area, there was not enough water in the area, and so water had to begin trucked in. In this area also, there was not enough capacity at the metropolitan level, the county level, even at the regional level. Eventually they became overwhelmed, and so it became a statewide response, and we'll talk a little bit more about that in a minute. But also because of the rural area that they were in, especially in 2008, cell phones were not reaching most of the valley, and internet capacity was still fairly low, and so techniques such as using road signs, the light up road signs, had to be used to communicate messages in a way that was appropriate both for the rural nature and as well as some limited English proficiency in the valley, led to the need for a very culturally appropriate response. You can see from this diagram that is borrowed from the CDC that even under the best circumstances, 2 to 4 weeks is normal for a response for a Salmonella outbreak, because there is the time needed for both from the time of contamination of the water to ingestion to the time where you become ill, and then the time it takes to get stool samples tested. It can take a significant amount of time. Luckily, in this case, you can see that even as the first cases were being reported, CDPHE being notified. These things happened over a number of days, and then a bottled water advisory was put in place prior to even the samples coming back as testing positive for Salmonella in the fecal tests, because the rate of infection had become so significant. And you can see after that people did begin to get well fairly quickly. We also, since they were so uncertain of where the contamination was from, they were not certain that anything that they were going to do imminently would stop the infections. During the event, multiple different things had to happen at multiple different jurisdictional levels. Unfortunately, there was one death. 24 individuals were hospitalized. 435 people were diagnosed with Salmonella. Many others likely were did receive lower levels of infection that they did not report or get treatment for. But some of the responses included: 1, the bottled water order; number 2, the communication of the bottled water order to the community; number 3, the delivery of massive amounts of bottled water, which we'll get to the number of folks that were involved in making that happen; and then the issue of treating the entire water system of the town, which required flushing the entire system and slowly refilling it with chlorinated water. Luckily, the system did hold up to that and was able to be in return to normal operating order in a relatively quick period of time. You can see that we have over 1,000 volunteers volunteering, about 4,500 volunteer hours, and about 60,000 gallons of water had been distributed. In terms of individual business loss, etc., there was about $1.5 million in loss. There were lawsuits against the city of Alamosa that were not nearly to that point that they were required to pay back. And then if you include the statewide response, adds about another $1 million to the cost of this event. In terms of the response, we did talk about a number of the things already, but number 1 being a large-scale investigation to determine where and how to remedy the problem, included walking all the lines. So they eventually found the cracks in the lines and determined that's probably where it was entering and addressed the water there. They then provided bottled water. Another thing that was very significant was inspection of each and every food establishment, and so a number of those businesses had to be shut down until health inspectors were able to arrive and ensure that their facilities had been both sanitized and then the water was coming out clean. And this is after the massive amount of cleaning and sanitizing of the system. And that led to a prevention of secondary cases, but also the prevention of secondary cases, which again goes back to being careful with the fecal-oral transmission routes, was also due to a really significant communication effort put forth at really all levels of the ESF, both state, county, municipal level. The city and county declared a disaster, and the governor allocated $300,000 to address the disaster while also declaring it a national emergency and allowing the National Guard to respond. So we get to the key players, which we kind of have touched on, but kind of in a systematic way. We'll go through them. The local public health agencies were the first to respond, with regional partners coming in next. Within a few days, the Colorado Department of Public Health and Environment were notified. Center for Disease Control even was involved, especially with the testing, which we'll skip down a couple, and the regional nurses group got together and collected the specimens, sent it to the CDC, got them diagnosed. But again, we talked about how the response was already well underway by that time. The Colorado National Guard was deployed, helping with both communications and water distribution. The Colorado Help Hotline was used. We'll talk about that later, about how that was both effective, but also how we needed more specific response in terms of communication that way. Red Cross came and again was involved in similar ways to the National Guard. Incident management teams were ordered, and they came from a number of different jurisdictions and helped out. And the Colorado Water Wastewater Agency Response Network came as a multidisciplinary team to really do the investigative work. And those Alamosa County Nursing Services is the nursing group that did the testing. One really significant is the volunteers that were mobilized, and this is attributed both to the many people who voluntarily came and spent significant amount of time. A lot of them showed up on Easter Sunday, helped with distribution of water, communication, but also to the effective way that they were planned for and utilized, and really made a difference in the response of this emergency and the way the community was able to be resilient and survive in a more effective way. In terms of the response, there were some things that went well, and there were some things that were obviously challenges. The quick decision to direct people towards bottled water was a lifesaver, literally, and prevented many illnesses. We're not really sure what would have happened if they'd been directed to boil their water, but there could have been other issues along with the arsenic that could have come from that. There was also a really good job of shifting command from the local level to the regional level to the state level, and then transitioning back to local control over the jurisdiction. The volunteers we've touched on, but especially the volunteer management staff need to be recognized for their efforts. And I think as we remember the map and realize that this is a fairly isolated region. The communication between individuals, groups in Denver, and the resources and humans that were able to get from Denver to Alamosa quickly really made a difference. The ICS roles played involve local regional staff management, which we talked about originally. Local folks were involved from March 2nd to March 15th, and then state agencies took control of the situation. I'm sorry, that was March 15th to March 23rd, and then from March 23rd to April 3rd, the state agencies took over, and that included the Colorado Department of Public Health and Environment, the co-help line, the water groups, the National Guard, and the governor being involved and taking control over the situation was outside of the capacity of the local folks, especially since this area was such a low income, low resourced area. And then returning command on April 3rd without, unnecessary martial law essentially being declared over the area. And the facilities and the training and the practice had been put in prior to this event, and so the Regional Emergency Operations Center became the incident command post, and individuals that were involved, especially in the professional roles, knew where to go to, where to report to, and how to communicate effectively with each other. And so that was very effective. We also had state level folks that were engaged relatively quickly, and those resources that were needed from the state, including epidemiology, were brought in. In terms of preparedness and resiliency, the biggest challenge is the poverty in the area and the lack of resources that were available prior to the event, and then in terms of returning to life as normal. Life as normal in the San Luis Valley already involves a number of different social determinants of health that are create daily challenges for individuals. And so that will continue to be a problem in that area for the foreseeable future. There were some changes that were made that were effective, but the region really underwent significant water issues for the next almost up until now, as the aging water systems and the lack of resources in that community really point towards a lack of preparedness in terms of being able to just have the daily functions that are necessary for that for daily health. But so in wrapping up, there are some lessons that we have learned or that can still be learned from this event. Some of those things that did happen that were already in the works were the new water treatment plant that did come online. There were a number of different municipalities that were under untreated water waivers, and those were reviewed across the state and really reduced the number of municipalities that were allowed to have untreated water. Some things that we can learn in terms of the response include realizing that all resources need to go through the logistics capacity, and this is in order to make sure that there aren't duplicative as well as gaps in terms of who gets water and other resources. A designated phone line would have been quite helpful in this instance, as the Colorado helpline got a number of different, or was just really overloaded and slow in terms of the way that it was able to respond. So having a dedicated line that can come online, that can come up quickly, could be very important. Volunteer mobilization, this is something that went well and something that we can learn from in the future as how to do that well by allowing volunteers to be involved and then giving them effective jobs that they can do. Another thing that we need to be aware of is that both local media and local partners need to be given information in a timely manner so that they can communicate and so that there are not both gaps in knowledge as well as inappropriate knowledge being shared. So there's a lot of things that we can learn from this event. One of them being just the nature of a low-resourced area and the fragility of which their day-to-day existence can be impacted by something as simple as water, and then also realizing that if we do have strong systems at the regional and state level, that they can intervene and make a difference in those areas when needed. I appreciate all of you guys giving time to listen to my presentation. And